It's the Pain Exam Podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the Pain Exam newsletter at painexam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the Pain Exam app with a premium subscription or access for free with a CME subscription at painexam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Morning and welcome back to the podcast. Happy you guys could join me and hope to see you guys. We have the New York, New Jersey Pain Congress this weekend. The NRAP Academy will be there. We have a table at the event. In addition, I have monthly courses, ultrasound IV, as well as ultrasound, regional anesthesia, and interventional pain that me or any of my instructors will be teaching. If you're looking to prepare for the boards, you could go to nrappain.org or painexam.com and sign up for the question bank or the virtual pain fellowship, which includes regional anesthesia and regenerative pain medicine. So as some of you know, if you're listening to the podcast, I occasionally suffer from pain. Currently, I'm 8 weeks out from an epidural PRP shot, which appears to be working. And I have been doing Pilates, which is amazing. I highly recommend if any of you guys ever have pain or want to do something different than physical therapy. And I've been taking turmeric every day. So I decided to do a podcast today on supplements and trying to figure out if there's really evidence for some of these supplements. And there's a lot of articles there. I'm using a few references that will be in the show notes. Now, before I start, I do have to say, if you are suffering from pain and you're in New York or willing to come to our office in Brooklyn, we're at aabppain.com. The phone number is 718-436-7246. We're accepting new patients. If you're not in New York and you can't come to New York and you just want my opinion, I do expert witness as well as expert chart review work. So you could just reach out to me at nrappain.org. My contact information is there or on the podcast. And I'll be more than happy to review the options with you and either guide you or send you to someone. I know a lot of people around the world who treat pain, so I could possibly send you to a colleague that's local if you're not willing to come to New York. The first one I'm going to discuss is called nutritional supplements for the treatment of neuropathic pain. Neuropathic pain is about a pain condition affecting 7 to 10% of the population, and it's often ineffectively or incompletely treated. The gold standard includes tricyclics, serotonin noradrenaline reuptake inhibitors, and anticonvulsants. And many patients will turn to non-pharmacological therapies such as nutrients or nutraceuticals. And the most often used supplements are vitamins such as B and D, trace minerals, zinc, and magnesium, herbal remedies such as curcumin and St. John's wort. However, evidence surrounding the efficacy and mechanisms of the supplements in the neuropathic pain is limited, and the scientific literature consists primarily of preclinical animal models, case studies, and small randomized controlled trials. Further, the authors say exploration into large randomized controlled trials is needed to fully inform patients and physicians on the utility of these supplements in neuropathic pain. And this article goes into summarizing the individual supplements. They start with zinc. So zinc's used to treat many conditions: macular degeneration, sickle cell anemia, alcohol-related liver disease, as well as neuropathic pain. The absence of zinc or zinc deficiency is associated with apoptosis, DNA damage, and immune suppression, due in part to the role of zinc in countering oxidative stress. Severe zinc deficiency is implicated in acrodermatitis enteropathica, which is fatal if untreated. Furthermore, zinc is playing a physiological role in allowing for activation of over 300 genes involved in macromolecule and protein synthesis, as well as cell growth and proliferation. The therapeutic benefits of zinc in the treatment of pain is attributed to anti-inflammatory properties such as metallothionein, which is important because inflammation is a driver of chronic pain states, including neuropathic pain. Zinc has been demonstrated to reduce pain in a number of preclinical models. First, in rats, likely due to anti-inflammatory properties. For example, in a model of rats that induced neuropathic pain, treatment with zinc led to significant reduction in hyperalgesia with a reduction in inflammatory biomarker ILB1 as well as nerve growth factor. Finding is important because NGF, nerve growth factor, is a major contributor to peripheral sensory hypersensitivity observed in neuropathic pain. Furthermore, NGF has been demonstrated to be an inducer of substance P in experimental models. CSF levels of substance P are increased in fibromyalgia patients with prototypical neuropathic pain disease model where serum substance P levels are normal or low in these patients. However, patients that have increased serum levels of angiotensin-converting enzyme ACE, a zinc-containing dipeptidase responsible for cleaving angiotensin 1 to angiotensin 2, as well as cleavage of substance P into its metabolites. The finding provides insight into the mechanisms by which zinc alters neuropathic pain. In another study using similar model, rats with sciatic nerve injuries treated with zinc had dose-dependent reductions in thermal hyperalgesia, and mice treated with paclitaxel to model chemotherapy induced neuropathic pain. The pain sensation was reduced through inhibition of capsaicin receptor TRPV1. So the rat model demonstrates the important role of zinc in sensory transmission, including its presence in the spinal cord and DRG. More recently, in mouse models, zinc finger proteins were implicated in regulation of nociception and pain sensation. But the evidence for zinc treating neuropathic pain in human clinical models is limited. Magnesium is a trace metal available as an over-the-counter supplement proposed for the treatment of neuropathic pain, and it's used to treat diabetic neuropathy, cancer-related neuropathic pain, chemotherapy-related pain, and post-traumatic neuralgia. The NMDA receptor, which is blocked by magnesium, has been implicated in the pathogenesis of neuropathic pain and targeted for treatment of the condition. The NMDA receptor is involved in central sensitization as well as numerous physiological processes in the central and peripheral nervous systems. The potential use of magnesium for the treatment of neuropathic pain is of interest because magnesium is an antagonist to NMDA receptor, and that's key in pain transduction. For example, magnesium has been demonstrated to down-regulate spinal cord NMD receptor phosphorylation in rats with diabetic neuropathy and decrease thermal and tactile allodynia. In double-blinded, randomized controlled trial of 45 patients suffering from neuropathic pain of various etiologies, oral magnesium supplement did not significantly improve neuropathic pain compared to placebo. In another negative trial of 10 patients, it's only 10 patients, with peripheral neuropathic pain, magnesium did not significantly reduce pain or allodynia, whereas ketamine reduced both. On contrary, a randomized controlled trial of 80 patients with chronic low back pain with a neuropathic pain component, sequential IV and oral magnesium improved pain intensity compared with 40 patients in the placebo group. Similarly, a small number of cancer patients with neuropathic pain refractory to opioids had improved pain with IV magnesium sulfate. IV magnesium sulfate also reduced neuropathic pain short-term in patients with pain from post-traumatic neuralgia. Interesting. Vitamin D for neuropathic pain. Well, interest in vitamin D really increased over the last few years. There's a lot of research around it. Repletion of vitamin D for treatment of neuropathic pain has been studied in patients with diabetes type 2 mellitus, a condition with high prevalence of vitamin D deficiency. Although there's no clear mechanisms for action, the treatment of pain with vitamin D, one proposed explanation is that vitamin D is involved in the regulation of inflammatory cytokines. Association between inflammatory cytokines and vitamin D levels have been previously demonstrated in diabetic neuropathy. In one prospective observational study of 51 vitamin D deficient diabetic patients with typical neuropathic pain, supplementation with D3 tablets, a mean dose of 259 international units. The vitamin D depletion resulted in significant reduction in neuropathic pain as measured by the McGill questionnaire. They wrote depletion. I think they mean repletion. Anyway, in another prospective study of 143 diabetic patients with diabetic neuropathy, patients were treated with a single dose of IM high-dose vitamin D, 600,000 IU. The intervention was associated with vitamin D repletion and a significant reduction in pain using the DN4 total pain score and the SFMPQ. These studies were observational, lacked control groups, and thus subject to bias, so use a grain of caution. There's still limited evidence. More evidence needs to be done. Vitamin B for neuropathic pain. We're talking about thiamine B1, pyroxine B6, folate B9, cyanocobalamin B12. They play critical roles in DNA and RNA synthesis, immunity, metabolism. They've been hypothesized to alleviate neuropathic pain in diabetic patients, and the hypothesis has been tested in both animal models. A cocktail of B1, 6, 12 was found to improve tactile allodynia in rats. But unfortunately, we don't care too much about rats. And there is a lot of interest in surrounding folate as a potential therapy for addressing neuropathic pain, given its critical role as a methylator in the nervous system. And even in the 1970s, folate was reported to be used for treatment of neuropathy. In one animal model of adult mice with spinal cord injury, folate reduced thermal hyperalgesia compared to the controls. In terms of the mechanism of action of vitamin B in treating neuropathic pain and neuropathy, it's really not clear. However, one explanation is that vitamin B12 plays an important role in nerve repair and myelination, thus improves symptoms of neuropathy, including pain. Overall, there are limited randomized trials of vitamin B for neuropathic pain. Larger trials are needed. Curcumin, spice, it's found in turmeric, and this has anti-inflammatory, antioxidant properties. It has a long history of being used as a remedy for wounds, aches, GI disorders, dating as far back as 1900 BC in India. It's hypothesized that the therapeutic mechanism of curcumin is via its inhibition of mitogen-activated protein kinase and suppression of the MAP kinase signaling. It's treating neuropathic pain in various murine models. 4 weeks of treatment with curcumin resulted in significant attenuation of thermal hyperalgesia in treated mice. Despite extensive studies in preclinical murine models, reporting in the literature of curcumin in clinical trials for neuropathic pain is limited. In a randomized controlled trial, a multi-ingredient formula containing curcumin, phytosome, piperine, and lipoic acid was tested in 141 patients with neuropathic pain, primarily chronic back, as an adjunct to NSAIDs, dexiibuprofen, compared with dexiibuprofen alone. The addition of the adjunct therapy significantly reduced neuropathic pain compared to dexiibuprofen alone and did not cause significant effects. By the way, I never heard of dexiibuprofen. Maybe this is a foreign study. I'll check after. Anyway, the use of adjunctive therapy significantly decreases the use of anti-inflammatory agents by this patient. The study further suggests the role of potential nutritional supplements as an adjunct therapy in the treatment of neuropathic pain. Anyway, St. John's wort, I'm going to skip to the conclusion because I'm running short on time. They need more investigations. It's well tolerated, and they're using it. There are documented side effects such as drug interactions, hypertensive crisis, photosensitivity. It's safe when used as a monotherapy for the most part, and it's a potent inducer of the P-glycoprotein cytochrome P450 enzymes that lower plasma concentrations of numerously commonly used drugs such as warfarin to tacrolimus. Despite evidence preclinical models for treating pain, demonstration of clinical efficacy of St. John's wort for neuropathic pain in human is limited. So once again, like everything else, we need more studies. So they do have a chart in this article, which you'll have the show notes to, talking about the doses required, or at least the ones available, and the recommended daily allowances, as well as the toxic levels. So I think you guys could check this out. They never really tested, it looks like, the vitamin B12 and the turmeric doses. I think those are more benign than some of the other things here, as well as zinc for the max doses. The toxic levels of zinc is 100 milligrams per day, magnesium 5,000 milligrams per day, vitamin D 10,000 IU per day, vitamin B9 not applicable, B12 not applicable, curcumin 8,000 grams per day, and you could buy a 500 to 1,000 milligram supplement. Now, I'm going to just quickly review a couple other studies and more or less their conclusions. Here's a study of nutritional supplementation in chronic pain from fibromyalgia. They basically say more studies are needed. That's really they do mention, though, interestingly, which you may or may not be aware of, that there is a proposed link between gut microbiome patterns and chronic pain syndromes. So probiotics actually might have a role, and that's a whole nother podcast. I'm not going to get into that right now. I don't have time for that. Here is vitamin D supplementation in another study showing that in veterans, that the vitamin D supplement to people in chronic pain can actually improve pain levels, sleep, and other qualities of life. And the last study that I'm going to briefly touch on is entitled The Role of Diet and Non-Pharmacologic Supplements in the Treatment of Chronic Neuropathic Pain, a systematic review. And basically, they talk a lot about chemotherapy-induced peripheral neuropathy, diabetic peripheral neuropathy, CRPS, and they conclude that they cannot recommend any supplement for chemotherapy-induced neuropathy, although further research into N-acetylcysteine, L-carnosine, crocin, and magnesium is warranted. Acetyl L-carnitine was found to be likely ineffective or harmful. Alpha-lipoic acid, which was recommended to me for my neuropathic pain prior to me doing the PRP for my neck, that was also found ineffective. Now, they're talking strictly for chemo-induced pain. Studies with gochagigan, which I'm not familiar with, B12, and vitamin E and glutamine had conflicting results regarding efficacy, and one gochagigan study was finding it harmful. That's probably why I don't know it very well, because if it's harmful, we're not using it. This is a word I'm probably going to botch up. Gulong Tongluo Feng, Ninjin Yoito, an antioxidant showed various degrees of potential effectiveness. You got to read this article. I'm not sure if I'm even saying that right. Never heard of these things. Regarding diabetic peripheral neuropathy, the report supports the use of alpha-lipoic acid, acetylcarnitine, and vitamin D. So that's interesting. So the alpha-lipoic acid, by the way, which can cause hypoglycemia, so caution with that. When I took it, I felt my blood sugar dropping. I kind of felt like that awful sensation when you're really hungry and you need something to eat. So be cautious with that. And the early use of vitamin C prophylaxis for development of CRPS1 seems promising. So there's some hope here for the diabetic patients. I do find, I think some of my biggest challenges are the diabetic peripheral neuropathy, or even worse, those shingles, those post-herpetic neuropathy patients that don't respond to anything. And my heart goes out to them, because that's a real challenging condition. Anyway, I really hope you guys found this useful. Please rate the podcast if you like it. If you don't, just tell me what I could do to improve it. Also, hope to see you guys at the conferences. Been quite busy this year. We do shadowing opportunities if you want to hang out with me for a day and do a ton of ultrasound procedures, or at least watch a ton of ultrasound procedures. Just reach out to me, and we do a package where we include the virtual pain fellowship in a shadowing opportunity, as well as have monthly courses, usually in New York, but I have one this weekend in Florida, and probably definitely as of right now, in Detroit in January and February. And if I can't make it, I do have instructors now. If you're interested in being an instructor or coming to the courses, just reach out to me. Thank you, and take care.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum. All rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without